Hello, everyone, and welcome to our inaugural 80% in Every Community conference. Although this may be our first 80% in Every Community conference, it's part of our 24th annual meeting of the National Colorectal Cancer Roundtable. And, you know, one advantage, of course, of this virtual format is we're able to have so many more people join us. And rather than our usual 230 participants in our live conference, as of this morning, we had about 750 people who've signed up with this conference, so we're really thrilled to have you. So the NCCRT is an organization of organizations. We've been committed and dedicated to increasing colorectal cancer screening rates, and as our little video showed, we're having tremendous success thanks to so many of you and to our members. We've grown enormously. Our membership has grown. Our impact has grown. We launched 80% by 2018 and 2014 at the National Press Club. You saw the big increase in screening that has resulted in part from this effort. And we now are really tackling the issue of achieving equity in our 80% in Every Community campaign. And the purpose of our annual meeting is really to update. This year, we're particularly tackling the challenges that we have particularly been evident this year due to COVID and the other changes going on in our society. And it's about learning, it's about being inspired, it's about sharing, it's about honoring tremendous contributions. So with that, let's get going. Let's start our meeting. Welcome to all of you, particularly the first timers here. So again, welcome to our 80% in Every Community conference and our 2020 NCCRT annual meeting. I'm Dr. Richard Wender, chair of the National Colorectal Cancer Roundtable, and our theme this year is Equity, Healing, Unity. Together, we can reach 80% in every community. We really want you to get engaged this year, and to do that through social media. Download our annual meeting guide at ncc.org. You'll see our 2020 annual meeting there. Engage on social media, share your photos and highlights. We have two hashtags this year. Use them both, hashtag NCCRT 2020 and hashtag 80 in every community. So let's see if we can burn Twitter up. We're going to have a chance for you to react through the meeting using Slido. You can ask questions through the CVent during sessions. So Slido is the way we're doing it this year. That's how we're going to answer polls. That's how you're going to share reactions and comments and questions. So if you've not already done so, open www.sli.do Slido and enter the meeting code NCCRT 2020, all one word, and the code will take you right to our polling and your chance to give feedback. I cannot tell you how grateful we are to all of our sponsors this year. We actually had more support this year than ever in the past. All of those dollars go straight to the efforts to increase colorectal cancer screening rates and to do everything we can to educate the entire nation. So a special shout out to our gold and silver sponsors, Exact Sciences and EpiProColon. Big thank you. Braintree, Colorectal Cancer Alliance, PolyMedco, Clinical Genomics, Quest Diagnostics, Bracco Diagnostics, Guardant, LabCorp, Medtronic, and Previon. Big shout out to our gold and silver sponsors. Our bronze sponsors, AmSurge, Colon Cancer Coalition, Colorectal Cancer Prevention Network, Premier Medical Associates, Bruce Waldholtz, Richard Wender, and our friends, the American College of Gastroenterology, the American College of Radiology, the Colon Cancer Prevention Project, Amy Manella, Mary Dorshank, and Linda Gall. I want to particularly make you aware of our 2021 80% in Every Community National Achievement Awards. This is a program we've had for a good number of years now since we launched 80% by 18. And we've been able to meet and honor some extraordinary organizations and individuals. You can nominate your organization, an organization you're aware of. You can nominate individuals, partners. We really have categories to accommodate any sort of tremendous achievement. And we'd love to get an all-time record high in nominations for our 80% in Every Community National Achievement Awards for 2021. It's now my real pleasure to allow you through video to meet Allison Rosen and Candace Henley, two survivors and also two brand new members of the steering committee for the National Colorectal Cancer Roundtable. So please listen to Allison and Candace.
Hello and welcome. My name is Allison Rosen, and I'm an 8-year colorectal cancer survivor, passionate patient, community, and policy advocate, and I also work professionally in the field of colorectal cancer prevention. When I was first diagnosed, I worked in the field of stem cell cancer research, and after going through years of treatment, I realized my true purpose. That was to use my story, experience, and knowledge to help others understand the importance of prevention and early detection of colorectal cancer. It is a true privilege to be here on behalf of the colorectal cancer patient, survivor, and caregiver community. I know you all will agree with me that the power of the patient voice is so important in the work that we all do. Even though we could not meet in person, I'm so happy that we could gather together virtually to educate, learn, and collaborate in an effort to help increase the colorectal cancer screening rate. This roundtable consists of researchers, clinicians, and epidemiologists, and so many other key stakeholders in the field of colorectal cancer. Now, more than ever, due to COVID-19, we need to work together. The work you are doing is helping to save lives like mine was, and you should never forget that. As a survivor, I sincerely want to thank you. I was honored to serve as a member of the planning committee for this conference, and I can assure you that the topics, speakers, and discussions will not disappoint. If there are any other survivors attending, I invite you now to introduce yourself and where you're joining from in the chat. Thank you so much for your attention. I will now turn it over to the next speaker.
Hi everyone, I'm Candace Henley, and it is my honor to welcome you to the 2020 80% in Every Community and the National Colorectal Cancer Roundtable annual meeting. This year's theme, Equity, Healing, and Unity, are near and dear to my heart, as my journey as an early age onset survivor was anything but equitable or healing, and the reason I became an advocate, an activist, and a voice in the fight for healthcare equality and equity. The conversations that will be had over the course of this conference may make you uncomfortable, as they should, but I ask you to stay present and stay engaged, because this work, our work, requires us all to be united to affect change. Thank you and enjoy the conference.
Thank you so much, Allison and Candace. We simply could not be doing our work without the amazing support of survivors. It's now my real pleasure and honor to launch our discussion for our annual meeting and our conference, Equity, Unity, Healing. Together, we can reach 80%. This is truly an extraordinary moment in our nation. We have not only failed to achieve cohesion, we're actually living through the most polarized moment in our nation's political history. This year has witnessed a more sincere, deep, and sustained discussion around the role of racism and structural racism as it affects health outcomes, a dialogue that we will take up here and needs to continue. And of course, we have lived through a once-in-a-generation global pandemic that, even as we speak, is raging through America. All of these have had an impact on our work, have caused us to reflect on what we have achieved, and what it will take to move forward. I do want to share with you, as you've seen, that we have an incredible amount to feel proud of. Prior to our launch of 80 by 18 back in 2014, colorectal cancer screening rates by one measure had plateaued, by others were moving slowly, and we have seen a steady rise in colorectal cancer screening rates since then, 2016 to 2018 being the largest two-year rise of any year that had been measured. By BRFS calculations, 9.3 million more people up to date with screening compared to the beginning of our campaign. If you look at another data source, the National Health Interview Survey, if you look at the rates that had plateaued between 2010 and 2013, and then following our launch started to increase, and again, from 2015 to 2018, over 3.5% rise, the largest three-year interval rise that we've seen in screening rates. This is fresh data just reported, and some of you may know that one of our most frustrating aspects of this campaign has been the very slow progress in commercial plans in the pre-Medicare population. And that's reflected in our 80% in every community strategic plan to try to impact this pre-Medicare population. We will still have work to do in Medicare, but we've seen tremendous progress. These are 2018 data. We don't have 2019 data yet for Medicare, but I do want you to join me in celebrating. So that's Medicare, the largest one-year increase in commercial plan screening rates from 62 to 64% that occurred from 2018 to 2019. We're really proud of that, and many people here today have helped make that happen. We've seen a small increase in the number of commercial plans that have hit 80%, so it can be done, even in the pre-Medicare population, now up to 12 plans. But take a look at what's been achieved in Medicare plans. We are now up to 105 healthcare plans serving Medicare patients who have exceeded our 80% goal. It's really tremendous. This doesn't show up as well as it should, but you can see the numbers that our community health center screening rates have been one of the great triumphs of the 80 by 18 and now 80% in every community effort. They were at 30.2% in 2012 when that was the first year that the federally qualified health centers measured CRC screening rates. And they have steadily and relentlessly climbed. Again, tremendous one-year increase to 45.6% in 2019. And now we have, I think, 26 FQHCs who have hit 80%, which is extraordinary given the population served. These are UDS measures, a map by state. And I want to give a real shout out to the states that are at over 60%. Again, these are federally qualified health centers. You look it up at those New England states who are a few of them over 60% and others over 50%. West Virginia, a state that faces usually enormous health barriers, at 53%. So huge shout out to West Virginia, everybody who's on the conference today. And I wonder if you've noticed which state had the highest rate among the federally qualified health centers. It's right here in Delaware at 65%. So big shout out to the efforts in Delaware, and there's a lot to learn from the Delaware experience. How about the rate of improvement in UDS? You see that almost everybody has improved. We've seen big increases, which we're thrilled about. Quite a number of states with 24 to 32% increase. And the biggest increase, I believe, right here, 30% in Iowa, the largest increase of any federally qualified health center group. Well, despite our progress, we have a lot of challenges, and particularly the challenges associated with the events of this year. All of you are aware it's received tremendous national attention that COVID resulted in a suspension of a lot of routine health care. Even people who had emergencies were not getting the care that they need. And you see a 285,000 missed breast cancer screens in this period of several months with the COVID pandemic. Colon cancer screens, about 95,000 estimated missed screens, and 40,000 missed cervical cancer screens. So a great deal of concern, almost certainly going to set back our overall national screening rate. We have to make that up, and then we have to move forward. This is a modeling study estimating the number of excess deaths that will occur because of the delay in screening that occurred this year. And that we start to see an excess of deaths even in this year, according to the models, but they continue for another decade due to a failure to remove a polyp or find a cancer early. You'll see the thousands of estimated deaths that will occur as a result of this delay in breast cancer in the lighter bar and colorectal cancer in the darker blue bar. This is cumulative, so this adds up as the years go by. It's not per year, it's a cumulative excess deaths. I don't need to tell you that the impact of COVID goes far beyond missed screens. In fact, we truly cannot at this point anticipate the full health impact of the COVID pandemic because it is so intimately tied to the financial status of the nation and of employers and how people get their insurance health benefits. If it's employer-based and people have lost their jobs, that has implications for screening. If people do not have disposable income, they are far less likely to prioritize preventive health care, particularly if it's associated with cost. So these are not new barriers. We've always had people who've dealt with insurance gaps, who've had financial barriers to screening, but COVID is going to exacerbate them. And it's particularly going to exacerbate disparities. The populations who were already achieving a lower screening rate, already suffering more from the direct impacts of COVID, are the exact same populations who are likely to experience more screening disparities. So what can we do to embrace and tackle the challenges in front of us? Well, one thing, as illustrated in this conference, is that we need to learn to work in new ways. We launched that effort at the end of 2018 with our 80% in every community new campaign, which shines a light on the importance of eliminating disparities. If you're new to this campaign, 80% by 2018 wasn't an averaging event. If a state had one part of the state or one health plan hitting 85 or 90, that could be averaged with a plan achieving a lower rate or a community achieving a lower rate. Our goal was 80 when it was all averaged together. That is not the goal of 80% in every community, which emphasizes particularly investing resources in those communities, both geographic and however we define community, that tend to achieve lower rates and have greater health burdens. So we are putting our heads together to tackle not only these disparities that existed before COVID, but the incredible delays in screening, drop in colonoscopies and biopsies, missed colonoscopies, missed general screening from all causes that will result in excess deaths. We do believe that empathy and connection with our communities is really central to this campaign of 80% in every community. It's about being inclusive. It's about being humble listeners. It's truly can only be accomplished by partnership and involvement of the community, and a need to learn and be nimble and be ready to do our work in a new way. We also recognize that this is not the job of any one person, any one organization, or any one sector. It demands hospitals, primary care clinicians, coalitions of all kinds, policymakers, health plans, employers, survivors, and others, to be sure. I don't think we're going to be able to do our work if we don't find some way to achieve healing and a greater sense of social cohesion. We all need to pledge to keep this discussion of racism alive and real and engaged. I've said to many people, I've heard more discussions of the word racism and structural racism in the halls of academics in almost every organization in the past 6 months since George Floyd's death than I had probably in my entire career. Thus, we launch our 80% in every community campaign. And we were thrilled to launch it. We had been ready and studying what is the campaign that follows 80 by 18 with all its success. And this campaign, 80% in every community, was unanimously and enthusiastically adopted by the membership of the National Colorectal Cancer Roundtable. And people continue to fight hard and come together to increase screening rates. One of the trends that you all know, I suspect, and if you don't know it, I'm glad you're here so that you can see it, has been a real epidemiologic shift in the incidence and mortality from colorectal cancer. And if you see in this pattern, after seeing a very good steady decline in Blacks and in whites and Hispanics in incidence, you see now a flattening or even an uptick in these last more recent time period. And we may well translate it into a flattening of the progress in mortality. And what is chiefly responsible for that? It is the rising incidence in colorectal cancer in younger people, originally seen only in rectal, predominantly in rectal and distal, now being seen in proximal colon cancer as well, although at a lower rate than rectal and distal increases. And particularly in younger populations, this is reversing some of the mortality progress that we'd anticipated enjoying and seeing. And it led the American Cancer Society to become the first organization based on modeling to recommend that screening, which we've always measured by the screening rates in 50 to 75-year-olds, needs to begin, even those for average risk, at age 45. I think you're all aware that one of the barriers to achieving that was a difference between the ACS guideline and the United States Preventive Service Task Force guideline. So at this conference, we now enter a new moment and a new challenge because the USPSTF in their latest draft guideline, now under review, and almost certainly will be seen in their final guideline, is now, like the American Cancer Society, recommending screening for colorectal cancer in adults ages 45 to 49, all the way up to 75. This will save more lives, but it also poses new opportunities and new challenges and will be a major focus of our conference this year. I cannot thank you all enough for being here, the work you do, the work you will do, and I look forward to your comments, your questions, which I believe you put into Slido. I think that's the way to do it. It's our amazing story, it echoed far and wide. We will screen you, we will screen you. We worked hard for 80 and fewer people died. We will screen you, we will screen you. Colorectal cancer's taken such an awful toll. But working as a family, we proved we can reach our goal. So here we are together to recommit our teams. We will screen you. Go out and tell our story to each community. We will screen you. We will screen you. The best test is the one that's done. That's our philosophy. We will screen you. We will screen you. COVID virus has exposed unjust disparities. We join as one to raise our voice as NCCRT. We will all work for justice in our communities. We will screen you. We all hear you. We will screen you.